embryologist. I've been in the field for about 18 years now. And in this journey of mine of being a reproductive embryologist, I've come to see a lot of patients that have gone through the process of fertility, the emotional aspect of fertility, and the psychological aspect, including the physical and pathophysiological. So today I'm going to be discussing an aspect of fertility called male infertility. It's not really spoken about a lot, and I think it's got to do mostly because of the masculinity complex with many males who in the fertility journey feel that they are not susceptible to the effect of infertility and it's not actually spoken about. So the definition of infertility, as I think everyone has touched on, is the inability to conceive after a year of unprotected intercourse. And if you look at couples around you, especially in your malls or you go in your malls and so forth, you can see that nearly 1 in 7 couples are afflicted or affected by infertility. And most of the time it's like 40% of them is female factor, 40% of the time is male factor, and 20% of the time is a combined male and female. But I think what's the important aspect of that is to see that it's no more just a one-sided part of it where it's only female. You can see that a male aspect also has a very important aspect with male infertility. And I think that is the important aspect, that males also are afflicted and affected by infertility as in comparison with the females as well. So when we look at male fertility, it's defined as the ability to cause a pregnancy in a fertile woman and is mainly concerned with the sperm. So I think many of the speakers already touched a lot about this, the sperm factor. Dr. Falchek also spoke about the aspect of the sperm. And we look at features of... I'm sorry. Okay. I'm back. So, if you look at the features of men's fertility, I'm sorry, I don't have my glasses so I can't see. So you look at sperm production aspect, and that is an important aspect because we're looking at where is sperm produced, and we know that sperm is produced in the testes, which is an important aspect, and it takes up to 74 days. So, as a nutritionist, the dietitian also spoke to us about it, is that if medication, supplements, and nutritional values is given to any patient, a male patient now, I'm just going to speak of the male aspect here. You're not going to see immediate or overnight changes in any of the parameters, your sperm parameters. And the reason behind this is because sperm production is at up to 74 days. So whatever you give now, or whatever was produced today, whatever ejaculate was given today, was made about 74 days, or in that up to 74 days ago. So it's not a true reflection of what is today or tomorrow. So that is an important aspect where the sperm production takes place. The sperm transport is another aspect of it because we know from the testes, then the sperm has to be transported to the external during ejaculation, and that is because of intimacy and arousal, and then the sperm is ejaculated. And the transport aspect of it is called the vas deferens, which is the transport tube that comes from the testis or leaves from the epididymis out into the external area. And the external area being into the vagina, so that the whole copulation process takes place. Then we also look at the sperm functions, and one important aspect is that the sperm is very resilient. It has to really work hard because it's going against a lot of things while it's going through this journey into the fallopian tube to find that egg. We know it's a process, and I love that movie, Look Who's Talking, where the sperm are swimming and getting to the fallopian tube, and the guys are talking to each other, come on guys, we can do this, we are almost here. And that's the story of sperm. They really have to go through many different aspects, cervical mucus and so forth, the vaginal defenses in order for them to get to that egg. And eventually they have to actually penetrate the egg and fertilize. So we spoke about the other aspect, which is healthy sperm. And this is the important aspect, is because one of the speakers mentioned that once the one sperm gets to the egg and penetrates the egg, there is no other sperm that will be able to enter after them. So it's a survival of the fittest, and only the healthiest, strongest, and the fastest sperm gets to fertilize the egg. And once it is done, he's the winner. So we look at aspects of the sperm, which is the count, and I'm going to go in more detail later on with this count, motility, which is the full progression of the sperm, and the shape of the sperm, which is called also the morphology. So one of the signs and symptoms that one sees with male infertility, and I think is the most evident and one is failure of pregnancy. Naturally, after a year of unprotected intercourse, you guys are having intimacy and are falling pregnant. So it's one aspect of it, because I think an important aspect is that if anyone looks at this aspect, can you clap with one hand? You can't clap with one hand, but you can only clap with two hands. So it's the male and the female aspect of it. So if you're not able to fall pregnant, both of you need to get tested. That's the male and the female, and not just one-sided. If the patient has erection or ejaculation problems, erection problems because it's the inability to have intimacy, and ejaculation problems where you're not producing an ejaculate that is called aspermia, or you have low volumes of ejaculate that is being produced, low sex drive, and that's got to do with the hormonal aspect of it, where you have decreased testosterone levels, which affects your libido, and problems with sexual function. And then I think another important aspect, women are always going about breast cancer, and we're talking about identifying and feeling yourselves and knowing your bodies, doing the examinations, breast examinations, but men also need to do testicular examinations. You need to feel your testes to see that there's no lumps or bumps or any type of foreign things that are happening in your testes. If there's any painful area, so pain, discomfort, a lump or swelling in the testicle area. Another important aspect is not a sign or symptom, but just to also, if you haven't had a history of testicle, prostate, or sexual problems, you need to consult with your specialist. And then the actual evident one, which is groin, testicle, penis, or scrotal surgery. So there are many causes of male infertility, but these are just some of the common causes of male infertility, which is like sperm counts, having low sperm counts, you're having obstruction in the genital tract, you're having structural defects on the sperm, you're having erectile dysfunction, which is a very common problem amongst men. Motility of the sperm, that is forward progression. The sperm is also swimming forward in a good direction with good motility, and sometimes the sperm starts swimming in circles. And we have to figure out what's happening there. And also volume of semen, and I think this is an understated aspect, which is the volume of semen, which actually is very important as well. So in the causes of male fertility, or male infertility, there's three types of causes. They are pre-testicular, testicular causes, and post-testicular. I think what's important to understand is that when you say pre-testicular is everything before the testes. Now we have to try and imagine that this is a one circle that we're having. So it starts off with the hypothalamus and the pituitary gland, which is in your brain, in which you get a stimulus to produce hormones. Those hormones then will be sent to the testes in order for production of sperm, to providing the signal for testosterone to be made in order for sperm production to be initiated. And thereafter, there's a negative feedback that goes back, sperm to be produced. And then also you have the process where sperm is then ejaculated. Once they ejaculated, you have a negative feedback that goes back to the brain to say, listen, you need to stimulate more hormone production because we need to carry on making sperm. I think the previous speaker said men are continuously making sperm all the time. So it needs to be continuously stimulated. So if you look at the first part, which is pre-testicular causes will be any problems that you have with the hypothalamus or pituitary gland where there is not enough secretions of the hormones. It could include pituitary hormones, it could gonadal insufficiency, or also insufficient stimulation of LH and FSH production as well. So the LH and FSH is the hormone that is needed to go down into the testes and to stimulate the testes to then start producing testosterone and to start the process of spermatogenesis, which is the sperm production process. In the testicle itself, there is different things that can happen. You can have genetic diseases, as Adele was speaking about, which is like you get your Klinefelter syndrome and so forth, that also microdeletion of the Y chromosome as well, that can cause infertility in the males. That's a genetic problem. Then you can have acquired problems, such as having varicocele. It's like having varicose veins on your testes, which inhibits the sperm production, and you get lower concentrations, you get lower motilities and morphologies. And then you can also get like hydrocele, accumulation of fluid around the testes, which also affects the process of sperm counts and sperm motility, sperm morphology, and so forth. And there's many other aspects like trauma, etc. And then you get the next one is post-testicular. So post-testicular is now, the sperm has been made, everything has been sorted out, now it needs to leave. It is stored in the epididymis, and it needs, so it's stored in the epididymis, and it needs to be transported to come out into the external air. But somehow you can get obstruction, and the obstruction can be, the term that you would know about obstruction you would see is called azoospermia, where there's no sperm in the ejaculate. Now it's very important to understand that semen is made up of 4 parts, which is one is the most important ingredient, sperm. That is the most important ingredient, and then it's made up of 3 secretions of 3 accessory glands. And these accessory glands are the prostate gland, the bulbourethral gland, and the seminal vesicle. With the prostate gland and the seminal vesicle giving you the bulk of the semen that you see. So the color, the smell, the appearance, and so forth is all as a result of all these accessory secretions. So what you're seeing in the ejaculate is not sperm. Is not, I think most people make that mistake. That's not sperm, it's a semen, which is made up of sperm and secretions of the accessory glands. So you can get obstruction because there may be a blockage in the vas deferens. The vas deferens is the tube that transports the sperm. You can get bilateral congenital absence of the vas deferens, which is as well. And they may have a patient may have had a vasectomy as well. A vasectomy, as everyone know, is when the vas deferens is severed in order for there's not to allow for any sperm to pass. So those are some of the post-testicular causes that you can get with regards to male infertility.